In our modern world, the pace of life is faster than ever before. With the constant demands of work, family, and social obligations, it's no wonder that mental health challenges are increasingly prevalent. Mental health challenges are not just isolated incidents, they are becoming a significant part of our daily lives. More and more people are finding it difficult to cope with the pressures and stresses that come with modern living. Millions of people struggle with depression and anxiety. These conditions can be debilitating, affecting every aspect of a person's life, from their ability to work and maintain relationships to their overall sense of well-being. In fact, studies show that 1 in 7 individuals in the UK rely on antidepressants for support. This statistic is a stark reminder of how widespread these issues have become. This highlights the widespread impact of these conditions on our society. It's not just a personal struggle, it's a public health issue that affects communities and economies. Antidepressants, when prescribed and monitored by healthcare professionals, can offer a lifeline for many individuals battling these disorders. They provide a way to manage symptoms and regain a sense of normalcy. They work by influencing chemical imbalances in the brain, helping to alleviate symptoms. These medications can help to restore balance to neurotransmitters, which are chemicals that transmit signals in the brain. However, like any medication, antidepressants come with potential side effects that need to be carefully considered. It's important for patients to be fully informed about what they might experience. These side effects can range from mild to more severe. While some people may experience only minor discomfort, others might face more significant challenges. Common side effects might include nausea, weight gain, or sleep disturbances. These can be inconvenient and uncomfortable, but they are often manageable with the right support and guidance. In some cases, more serious side effects can occur, such as an increased risk of suicidal thoughts or actions, particularly in younger individuals. This is why close monitoring by healthcare professionals is essential. It is crucial to remember that everyone responds to medications differently. What works well for one person may not be suitable for another. This variability makes personalized care and attention all the more important. What works well for one person may not be suitable for another. This underscores the importance of a tailored approach to treatment, where healthcare providers work closely with patients to find the best solution for their unique needs. This underscores the vital role of regular communication with your healthcare provider throughout your treatment journey. Open and honest dialogue can help to ensure that any issues are addressed promptly and that the treatment plan remains effective and appropriate. Support groups and therapy sessions can also play a crucial role in managing mental health conditions. They provide a space for individuals to share their experiences and learn from others who are going through similar challenges. In addition to medication and therapy, lifestyle changes such as regular exercise, a healthy diet, and mindfulness practices can significantly improve mental health. These holistic approaches can complement traditional treatments and provide additional relief. Raising awareness about mental health is essential. Community events and educational programs can help to reduce stigma and encourage more people to seek the help they need. Education is a powerful tool in the fight against mental health issues. By learning more about these conditions, individuals can better understand their own experiences and those of others, fostering a more supportive and empathetic society. Ultimately, the support of family and friends can make a significant difference. Having a strong support network can provide the encouragement and understanding needed to navigate the challenges of mental health. With the right combination of medical treatment, therapy, lifestyle changes, and support, individuals can manage their mental health conditions and lead fulfilling lives. The journey may be challenging, but it is one that can be navigated with the right resources and support. Remember, mental health is a growing reality, but with awareness, understanding, and support, we can make a positive impact on the lives of those affected. Recently, a groundbreaking study from Denmark has sent shockwaves through the medical community. This study, which has been meticulously conducted over several years, has brought to light some startling revelations that have significant implications for both patients and healthcare providers. Published in a prestigious medical journal, the study revealed a potential link between antidepressant use and an increased risk of sudden cardiac death. The findings were based on comprehensive data analysis and rigorous peer review, ensuring the credibility and reliability of the results. This alarming discovery has sparked widespread concern and debate among both healthcare professionals and the public alike. Doctors and researchers are now questioning the safety of commonly prescribed antidepressants. while patients are left wondering about the potential risks associated with their medication. The study, which followed a large cohort of individuals over a significant period, found that those taking certain types of antidepressants were at a higher risk of experiencing sudden cardiac death. The researchers meticulously tracked the health outcomes of thousands of participants, ensuring that the data collected was both comprehensive and accurate. Sudden cardiac death, as the name suggests, is a catastrophic event characterized by the abrupt loss of heart function. It is a medical emergency that requires immediate intervention, and unfortunately, it often results in fatality if not promptly addressed. It often occurs without warning and can be fatal. The sudden nature of this condition makes it particularly dangerous, as there is little to no time for medical intervention once the heart stops functioning properly. The study's findings suggest that antidepressants might play a role in disrupting the heart's normal rhythm, potentially leading to this life-threatening condition. The exact mechanisms by which antidepressants may cause these disruptions are still not fully understood, but the evidence points to a significant correlation. While the study's results are undoubtedly concerning, it's crucial to maintain a balanced perspective. Antidepressants have been life-saving for many individuals, helping them manage severe depression and anxiety. The benefits of these medications should not be overlooked, even as we consider their potential risks. It's essential to remember that this is just one study, and more research is needed to confirm these findings and fully understand the implications. The medical community is already mobilizing to conduct further investigations, aiming to replicate the results and explore the underlying causes of the observed increase in cardiac risk. Until then, patients are advised to consult with their healthcare providers before making any changes to their medication regimen. If you are currently taking antidepressants, do not stop your medication abruptly. Instead, have a detailed discussion with your doctor about the potential risks and benefits. Your healthcare provider can help you weigh the pros and cons and decide on the best course of action tailored to your individual health needs. The medical community is committed to ensuring patient safety and will continue to monitor and investigate the potential risks associated with antidepressant use. Ongoing research and open communication between patients and healthcare providers are key to navigating these complex issues. As we move forward, it is crucial to support further research and stay informed about new developments. The collaboration between researchers, healthcare providers, and patients will be essential in addressing the challenges posed by these findings and ensuring the best possible outcomes for all. Delving deeper into the Danish study's findings reveals a particularly concerning trend. The risk of sudden cardiac death appears to be amplified by two key factors: duration of antidepressant use and age. The longer an individual was on antidepressants, the more pronounced the risk became. This suggests a potential dose-dependent relationship, where prolonged exposure to these medications might have a cumulative effect on cardiac health. This finding underscores the importance of regular reviews of antidepressant prescriptions with your doctor. Furthermore, the study highlighted a particularly vulnerable age group: individuals between 30 and 39 years old. This demographic exhibited a significantly higher risk of sudden cardiac death when using antidepressants compared to other age groups. While the reasons behind this heightened risk in younger adults remain unclear, it could be linked to a combination of factors. These might include differences in metabolism, underlying health conditions, even genetic predispositions. The Danish study's findings have ignited a firestorm of debate within the medical community. The research, which suggests a potential link between the use of antidepressants and sudden cardiac death, has sent shockwaves through the healthcare sector. This revelation has prompted a reevaluation of current medical practices and guidelines. Experts around the globe are grappling with the implications of this potential link between antidepressants and sudden cardiac death. The study's results have led to intense discussions at international medical conferences, where healthcare professionals are debating the validity and impact of these findings. The global medical community is now faced with the challenge of balancing the benefits of antidepressant medications with their potential risks. Dr. Jasmin Mujkanovic, a leading cardiologist, urges caution, emphasizing that these findings should serve as a wake-up call for doctors to carefully consider the potential cardiac risks, especially in younger patients. He stresses the importance of not dismissing these findings, as they could have significant implications for patient safety. Dr. Mujkanovic advocates for a more cautious approach to prescribing antidepressants, particularly for individuals with pre-existing heart conditions or those at higher risk of cardiac issues. He advocates for thorough cardiac screenings before initiating antidepressant treatment and regular monitoring throughout the course. This proactive approach, he believes, could help identify patients who may be at greater risk of adverse cardiac events, allowing for timely interventions and adjustments to their treatment plans. Dr. Mujkanovic also calls for increased collaboration between cardiologists and psychiatrists to ensure comprehensive care for patients. On the other hand, Professor Joanna Moncrieff, a renowned psychiatrist, cautions against hasty conclusions. She warns that the study's findings, while important, should not lead to an immediate overhaul of current treatment protocols. Professor Moncrieff highlights the need for further research to confirm these results and to better understand the mechanisms behind the potential link between antidepressants and cardiac events. She emphasizes that while the study raises valid concerns, it's crucial to remember that untreated depression also carries significant health risks, including an increased risk of heart disease. Depression is a serious condition that can have devastating effects on a person's overall health and well-being. Professor Moncrieff points out that untreated depression can lead to a range of physical health problems, including chronic illnesses and a higher likelihood of developing cardiovascular diseases. Professor Moncrieff underscores the importance of individualized treatment plans, stating each patient's situation is unique, and decisions regarding antidepressant use should be made on a case-by-case basis, carefully weighing the potential risks and benefits. She advocates for a personalized approach to mental health care, where the specific needs and circumstances of each patient are taken into account. This approach, she believes, will help ensure that patients receive the most appropriate and effective treatment for their condition, while minimizing potential risks. The debate sparked by the Danish study highlights the need for ongoing dialogue and collaboration within the medical community. By working together, healthcare professionals can develop more comprehensive and balanced treatment strategies that address both the mental and physical health needs of their patients. This collaborative effort is essential for advancing our understanding of the complex relationship between mental health treatments and overall health outcomes. As research continues, it is crucial to remain vigilant and open to new findings. The medical community must stay informed about the latest developments and be prepared to adapt their practices based on emerging evidence. This commitment to continuous learning and improvement will help ensure that patients receive the safest and most effective care possible. Ultimately, the goal is to provide patients with the best possible care, taking into account both the benefits and risks of treatment options. By carefully considering the implications of studies like the Danish research, healthcare professionals can make more informed decisions that prioritize patient safety and well-being. This